Monday marks 1 year since Iowa's first confirmed cases of COVID-19. We'll hear from the state public health department leader who explains how she decides which groups will get the vaccine first. Plus, an Iowa congresswoman's here on the virus's impact on her family and what to do about the delay the virus caused on gathering census data. And in the Insider's Quick Six, what happens if Senator Grassley does not run again?
From your local election headquarters, this is The Insiders with Dave Price.
On March 8th, 2020, Iowa Governor Kim Reynolds announced that 3 people in Johnson County were presumed to be infected with that new COVID-19 virus. They'd been part of a group traveling with a cruise line through Egypt. Now, since then, more than 5,500 Iowans have died with the virus. More than 365,000 people tested positive. Pfizer, Moderna, and Johnson & Johnson vaccines have now arrived to immunize those wanting protection, and for those who've actually been able to get some of that share of this limited supply. We sat down with the interim director of the Iowa Department of Public Health about where the state stands now.
We are very close to offering vaccines to anyone who's willing to take them, and we're very hopeful that everyone will. But even as we move forward, we still need science to catch up with where we are. And our scientists have done a phenomenal job this past year. But there's still work to be done while we navigate reopening, reentry, and figuring out what life looks like going forward.
You talk about navigating here. How do you do this through this process in that you have to have priorities because we don't have enough vaccines to just flip a switch and everybody goes? Walk us through how you go through that process, because you do have to, at the end of the day, put some people above other people.
Yeah, toughest decisions, some of the hardest I've had to make throughout this response and in my tenure as director in the state. We gathered a team of clinicians, ethicists, practitioners, and associations that represent vulnerable Iowans, and sorted through medical evidence and really worked at data points, looking at data points to draw the list that we have today in tiers. And ultimately, what we're trying to do is get to a ramp up capacity with vaccine distribution where we don't have to use the tiers any longer.
Part of this has been done through a committee that essentially works sort of in private. Explain why that is done that way.
Absolutely. Good question. Tough question again, because these are really challenging discussions. And it's not that I don't want there to be transparency around the decision making. I absolutely do, and I'm happy to talk about it. But the dialogue that happens behind those closed doors, I don't necessarily want the individuals who I've asked to leave their professional jobs, who might be associated with those employers and who are asking really tough questions of their colleagues, to necessarily be called out by asking those tough questions. So ultimately, I'm proud of the work we did with that group. I'm proud of the recommendations they made, and we made sure to make the minutes transparent and the decisions, and then I'm happy to talk about it and at a deeper level at any time.
So, but those discussions end up being teachers should come before this profession, or this age group comes before this profession. Do you go by national guidance? How is that? Do you look at our demographic information? How is that decided?
Absolutely. So it's a mix. And President Biden announced yesterday afternoon that teachers need to come first. And in fact, our federal pharmacy partners are now offering the vaccine to teachers as of today. So it's a mix, federal guidance, and absolutely looking at Iowa-specific data points. I mean, that has to be taken into every account as we morph and change guidance moving forward.
What is realistic, do you think, as we're talking to you, the Johnson & Johnson vaccines are just starting to arrive? You have some pumping through your veins because you were already vaccinated with this. When do you expect, in such an uncertain supply chain here, when do you expect, we're at 100,000 or so a week coming in, when are we going to see 200,000 or 250,000 or whatever? Is there any way to, how do you project that?
So we're working with our federal partners to provide those projections. The key to planning and the key to standing up mass vaccination clinics and other entry points that are easier to navigate is the stability in supply. We're not quite there yet, but we've seen over the course of the last 2 months our supply quadruple. So I think they've absolutely proven that those solid track and solid distribution into Iowa is happening. Right now, we just need to work on a cadence that is where it's a bit more stable and predictable.
So you went up on stage with the governor and her husband, and you all got vaccinated. And as you would know, right afterwards, people blow up on social media about, she thinks she's special. Why is she cutting to the front of the line? Because you're not old.
No. Well, thank you for that. No, I'm not.
And I didn't mean that in a disparaging way but to anybody else either.
I am not in the 65 plus category, and I realize that. And obviously, my work and my role is privileged in terms of this access point, and the governor asked me to sit there with her to demonstrate safety and confidence in the vaccine. But I also work directly with facilities. It's my job to oversee those facilities. You've asked me some tough questions around my management of those facilities, and I have been unable to visit clients this entire time. So my choice was really to demonstrate to my Department of Human Services team that it is safe and effective, and to get back out there seeing clients.
Some of those clients, in some cases, they are not able to verbally consent to things, right? So how has the state handled vaccinating those folks?
A lot of work with their guardians, and we still have some more work to do in spaces, but we have a lot of conversations through our social work team at each of the facilities in our respective spaces in the agency to really guide those conversations and make sure they have the information to make the best choice for their loved one.
By the end of May. That's progress, important progress.
Looking at the numbers that you see, I know you can listen to the president's words, but do you feel optimistic that it will be true that by May, if you want a vaccine, you can get a vaccine?
I do.
You see the supply chain increasing that much and we can pull that off?
I do. I absolutely do. I mean, I think they've told us what they expect to see, and they've delivered on it, which is phenomenal.
You still have 2 jobs.
I do.
Is 2 jobs going to become 1 job here? So you're heading 2 agencies at the same time through a pandemic.
Yes, sir.
A, how is that possible? And is B, this part of the long term to have these 2 become merging into 1? How's this going to work?
So that is absolutely the task that the governor has asked me to do in serving in these dual roles, is to really work on the connection points between the 2 agencies. And I'll tell you, I did this work in Texas, so perhaps my training ground was well spent. We had all of the services that are housed in these 2 agencies in Iowa under an umbrella structure in Texas. So I'm kind of used to the size and scope. In fact, a larger size and scope in some respects. And so that was solid training ground for me as an individual. Now the work is to really assess how these agencies come together. So it could be 1, could be some iteration thereof. We have a year-long effort to do that work. So we do it thoughtfully and with what's right for Iowa.
And other states, as you mentioned, Texas, but there are states across the country that have done something like this.
Absolutely.
Will you step back for a moment and talk about, this is sort of an unprecedented thing we've gone through. Not sort of, it is an unprecedented thing the state has gone through the last year. Becoming a public figure, standing in front of the camera in these public briefings, and that obviously it's our job to ask you tough questions that we get from Iowans. What is it like to make these decisions? You will have some people who say the state should have done more here, mask mandates, shut things down sooner, whatever it was. But you have the other side that think none of this should have happened and should let herd immunity progress on its own. So there are going to be people who question your motivations, your decision making, why you do things the way you do, why you recommend to the governor what she should do. How do you go through that process? What's that like?
So I think, again, I look back at the leaders that I've worked for over the course of my career and the tough decisions I've watched them make, and then now being in a chair, it is a different position to be in. This has stressed all of that learning in a different way. I'm lucky to be surrounded by really phenomenal team members who are there to provide clear information in a reliable way. And my approach to that is to listen to them. Really make sure that we are having that robust dialogue in a way that invites criticism internally so that we can give the best recommendations. And then I think you have to get a tough skin. These weren't decisions where we were going to make everyone happy, and I know that. I tried to make the best decisions at a time to move quickly with the best information we had available, and then remain flexible to shift and acknowledge spaces where we didn't get it right.
But this is a new dynamic in the sense that there was very little, almost nothing known about this when this hit. So you have to rely on science that may not exist yet.
Yes, absolutely. So the best available at the time, and predictive where we can, and using the playbooks that we've had for other disease surveillance and emergency responses, because there's a little bit of more than just the scientific nature here, right? And then spaces where, for example, you know, the one of the toughest decisions I made during this response was to tell parents that they couldn't see their loved ones, both in the facilities and on the child welfare side of our work. But we did it out of We didn't know. We didn't know better. And as soon as we did, we lifted that. Now we know how to do it safely. We know how to have those physical interactions and visitation safely, but we didn't then. Unbelievably hard decision for me to make, to tell a parent that they can't see their child.
And not to get too personal, but you have not seen your parents either.
Correct. My in-laws, I have not seen for 1.5 years.
Long time.
Long time.
Emotional topic. Next, Congresswoman Ashley Hinson on what happened when the virus hit her family, plus whether Congress can get involved with the Census Bureau.